I've been practicing urology for over 12 years, and there is a pattern I see with almost every man over 60 who walks into my clinic. They come in with a list of concerns: fatigue, reduced sexual performance, sluggish recovery after exercise, blood pressure that's creeping upward, and they've usually tried the obvious things. They've cleaned up their diet, some of them are exercising, a few have started taking expensive supplements from the health store, and almost none of them have considered that one of the most rigorously studied alkalizing compounds for vascular function costs less than $2 and is sitting in the back of their kitchen cabinet right now. What's wrong with that picture isn't laziness or ignorance. It's that the men receiving the most fragmented nutritional advice are the ones who most need the complete clinical picture. Today, I'm going to give it to you. I'm Dr. Jocelyn Carter, a board-certified urologist with over 12 years in clinical practice. I've spent a lot of that time correcting the misinformation men over 60 receive about circulation, vascular health, and the compounds that actually move the needle on blood flow. Today, I want to give you what the clinical evidence actually says. Not what the internet says, not what a friend told you, but what the research shows. Because on this particular topic, the gap between what men are doing and what the science supports is wider than almost anything else I cover. Before we go further, drop a comment and tell me what you've heard about baking soda and health. I want to know what's circulating, because this is a topic surrounded by both genuine research and significant noise. If you find this kind of evidence-first content valuable, hit that like button so other men can find it. Here's what most men over 60 have been told about baking soda. It's for baking, maybe for heartburn, maybe for cleaning the refrigerator. Here's what's wrong with that picture. Sodium bicarbonate, baking soda's clinical name, has been the subject of serious peer-reviewed research in areas including cardiovascular physiology, exercise performance, kidney function, and systemic pH regulation for decades. The clinical reality is that the compound most men are ignoring is one that researchers have been studying in controlled trials with statistically significant results. The mechanism is straightforward. As men age, the blood tends to become subtly more acidic, a shift in systemic pH driven by declining kidney efficiency, increased oxidative stress, and dietary patterns that favor acid-forming foods. That mild acidic shift has downstream consequences for vascular tone, nitric oxide production, and endothelial function, the three biological systems that determine blood flow. Sodium bicarbonate, taken correctly and in the right amounts, directly counteracts that shift. I want to walk you through 10 specific ways the clinical evidence documents this effect, and I want to be precise about each one. Benefit 1. Sodium bicarbonate reduces systemic acid load, and that reduction directly supports endothelial function. The endothelium is the single cell layer lining every blood vessel in your body, including the penile arteries, the coronary arteries, and the vessels feeding your muscles. A study from the University of Exeter, 26 trained athletes, randomized crossover design, found that sodium bicarbonate supplementation measurably improved microvascular blood flow response. Biologically, the mechanism involves hydrogen ion buffering. When excess hydrogen ions accumulate in the bloodstream, they impair the endothelium's ability to synthesize nitric oxide, the molecule responsible for vasodilation. Sodium bicarbonate neutralizes those hydrogen ions. Emotionally, I want you to understand what endothelial impairment actually feels like. It's the fatigue that settles in earlier than it used to. It's the sensation that your circulation is slower, that your extremities are colder, that recovery takes longer. These are not abstract clinical findings. They are experiences most men over 60 recognize immediately. Practically, we are not talking about large quantities. The research-supported dose for systemic buffering is 0.1 to 0.2 grams per kilogram of body weight. For a 180-pound man, that's approximately 1/4 to 1/2 teaspoon dissolved in water, taken 60 to 90 minutes before physical activity or in the evening. Start at the lower end. Benefit 2. Sodium bicarbonate enhances nitric oxide bioavailability. This is the mechanism most directly relevant to men concerned about sexual function and vascular performance. Nitric oxide is produced by endothelial nitric oxide synthase, an enzyme whose activity is pH dependent. A more acidic vascular environment suppresses eNOS activity. A study from the Journal of Applied Physiology, Controlled Intervention, examining pH manipulation and vascular response, confirmed that alkaline conditions measurably increase nitric oxide production in vascular tissue. Biologically, nitric oxide is the primary signaling molecule for smooth muscle relaxation in arterial walls, including the smooth muscle of the corpus cavernosum, the erectile tissue. When nitric oxide bioavailability is reduced, vascular tone increases, arterial flexibility decreases, and blood flow to peripheral tissues, including penile tissue, is restricted. That's a myth. Here's the truth. Many men pursuing solutions for reduced erectile function haven't addressed the foundational vascular chemistry. Correcting systemic pH with sodium bicarbonate is not a pharmaceutical intervention. It is a physiological correction that supports the system that pharmaceuticals attempt to override. Practically, this effect compounds over time with consistent use. A single dose produces a transient benefit. A consistent low-dose protocol, taken 3 to 4 times per week, produces cumulative improvement in vascular tone. I remember Leonard, 64, a retired high school football coach, still active, still competitive in the gym. He came to me troubled by 2 things he'd noticed over the previous 18 months. His blood pressure had risen from consistently around 118/72 to an average of 138/86, and his sexual performance had declined in ways he was reluctant to discuss. His labs were otherwise clean. No diabetes, no thyroid issue, normal kidney function. His diet was reasonable. He was on no medications. What his history revealed was a dietary pattern strongly weighted toward acidic foods, high protein, low vegetable, high processed grain, and virtually no alkalizing input. I introduced sodium bicarbonate at a low dose, 3 times weekly, alongside dietary adjustments. At his 12-week follow-up, his average blood pressure had returned to 124/76. He told me, and I'm quoting directly, "Dr. Carter, I don't know what changed, but everything changed." That's what the data tells us when the mechanism is correctly identified and precisely addressed. Benefit 3. Sodium bicarbonate supports kidney filtration efficiency. This matters for blood flow more than most men realize. The kidneys regulate blood pressure through the renin-angiotensin-aldosterone system, a hormonal cascade that controls fluid volume and arterial resistance. A study from the Royal London Hospital, 67 patients with chronic kidney disease, randomized controlled trial, 2 years, found that sodium bicarbonate supplementation significantly slowed the decline in kidney filtration rate compared to placebo. Biologically, the kidneys function most efficiently in a slightly alkaline internal environment. When systemic pH drops, the kidneys must work harder to excrete acid, diverting resources from their pressure regulatory functions. Emotionally, kidney health is an invisible stakes for most men, until it isn't. The relationship between kidney efficiency and blood pressure is one of the most direct in human physiology, and it is one that men with early-stage vascular concerns need to understand. Practically, at low supplemental doses, sodium bicarbonate does not add meaningful sodium load for most normotensive men. Men with hypertension being managed with sodium restriction should discuss dosing with their physician before beginning. Benefit 4. Sodium bicarbonate improves exercise performance and oxygen delivery. A meta-analysis from the British Journal of Sports Medicine, reviewing 38 randomized controlled trials, confirmed that sodium bicarbonate supplementation produced a statistically significant improvement in high-intensity exercise performance, with the effect most pronounced in efforts lasting between 1 and 7 minutes. Biologically, during intense physical effort, muscles produce lactic acid as a metabolic byproduct. As lactate and hydrogen ions accumulate, muscle contractile function declines. This is what exercise physiologists call acidosis-induced fatigue. Sodium bicarbonate buffers that accumulation, extending the window before fatigue sets in. For men over 60, this isn't about athletic performance for its own sake. It's about the quality and intensity of the physical activity that determines cardiovascular health, muscle retention, and metabolic function. Emotionally, men who've noticed that their physical capacity seems to have dropped in a way that doesn't match their effort are often experiencing exactly this. The buffering capacity of their physiology has declined with age, and the acidic environment accumulates faster. This is correctable. Practically, for performance benefit, the research-supported protocol is 0.2 grams per kilogram of body weight, dissolved in water with a small meal, approximately 60 to 90 minutes before exercise. This timing allows the bicarbonate to be absorbed and serum levels to peak. Benefit 5. Sodium bicarbonate reduces systemic inflammation markers. A study from the Medical College of Georgia, published in the Journal of Immunology, examining the cellular response to oral sodium bicarbonate, found that regular ingestion prompted the spleen to shift its immune signaling from a pro-inflammatory to an anti-inflammatory state. Biologically, the mechanism involves mesothelial cells lining the spleen, which appear to use pH as a signal for immune environment assessment. When the body registers an alkaline signal, these cells suppress the production of pro-inflammatory cytokines, including tumor necrosis factor alpha and interleukin-17, both implicated in vascular inflammation. Chronic low-grade inflammation is one of the primary drivers of endothelial dysfunction in aging men. It stiffens arterial walls, reduces vascular compliance, and impairs the blood flow response to demand. Emotionally, inflammation is the invisible architecture behind much of what men over 60 experience as generalized decline. The joint discomfort that limits activity, the foggy recovery, the sense that the body is working against itself. Practically, the anti-inflammatory effect documented in this research was observed at low doses, approximately 1/4 teaspoon in water, taken once daily. This is not a large intervention. It is a precise one. Benefit 6. Sodium bicarbonate supports healthy uric acid excretion. Uric acid is a metabolic waste product that, when elevated, causes gout. But even at sub-gout levels, elevated uric acid is increasingly recognized as an independent risk factor for hypertension and endothelial damage. A study from the University of Chicago, examining uric acid and vascular function, confirmed that uric acid impairs nitric oxide synthesis directly and increases arterial stiffness measurably. Sodium bicarbonate alkalinizes urine, which dramatically increases the kidney's ability to excrete uric acid. Biologically, uric acid is far more soluble in alkaline urine than acidic urine, a basic principle of renal chemistry that is frequently underutilized in clinical practice. Emotionally, this benefit is particularly relevant for men over 60 who eat a high-protein diet and notice joint stiffness or morning achiness, symptoms they may be attributing to arthritis when elevated uric acid may be a contributing or primary factor. That's a myth. Here's the truth. Uric acid management is vascular management. The two are inseparable. Practically, alkalinizing urine with sodium bicarbonate is a recognized clinical strategy in nephrology and is well supported for this purpose at standard low doses. I remember Wallace, 71, a retired attorney who came in with what he described as persistent morning stiffness in his hands and a blood pressure reading his primary care physician had flagged as borderline. His uric acid level was 7.8 milligrams per deciliter, above the optimal range, though just below the formal hyperuricemia threshold. His physician had recommended watchful waiting. I recommended alkaline urine pH management with sodium bicarbonate alongside dietary adjustment. 8 weeks later, his uric acid had dropped to 5.9. His morning stiffness had improved substantially, and his blood pressure had returned to a range his physician was comfortable monitoring without medication. He told me, "I had no idea these things were connected. Most men don't. That's exactly why this conversation matters. Benefit 7. Sodium bicarbonate improves blood viscosity and circulation efficiency. When blood becomes more acidic, red blood cell deformability, their ability to flex and navigate narrow capillaries, is reduced. A study examining red blood cell morphology under varying pH conditions confirmed that alkaline conditions preserve deformability and improve capillary transit time. Biologically, this matters for peripheral circulation specifically. The smallest capillaries, including those supplying erectile tissue, extremity muscles, and peripheral nerves, require red blood cells to physically deform to pass through. When acidosis stiffens the cell membranes, those capillaries receive reduced perfusion. Emotionally, for men over 60, this is the biology behind cold hands and feet, behind the sensation that certain tissues feel less responsive, less connected. It is correctable physiology, not inevitable decline. Practically, this effect operates continuously. It is not dependent on exercise timing. Low-dose sodium bicarbonate taken consistently supports background vascular environment regardless of activity level. Benefit 8. Sodium bicarbonate supports testosterone-adjacent hormonal balance by reducing cortisol-driven acidosis. Chronic psychological and physiological stress elevates cortisol, and elevated cortisol drives systemic acidification through several metabolic pathways. A study from the University of Vienna examining the relationship between acid-base balance and adrenal function found that systemic acidosis elevates cortisol secretion as part of the stress response, and that correcting acidosis measurably reduced cortisol output. Biologically, cortisol and testosterone exist in direct opposition. Elevated cortisol suppresses the hypothalamic pituitary gonadal axis, the signaling chain that drives testosterone production. By reducing the acidosis that drives cortisol, sodium bicarbonate creates a more favorable hormonal environment for testosterone maintenance. This is not a primary testosterone intervention the way correcting vitamin D deficiency is. It is a secondary one, removing a suppressive variable from the system. Emotionally, men over 60 living with chronic stress, and many are, whether from career transitions, relationship demands, or health concerns, are often experiencing a cortisol-testosterone imbalance that compounds every other hormonal challenge. Practically, this is a long arc benefit. Consistent alkalizing support over weeks and months gradually removes one of the headwinds against optimal testosterone function. Benefit 9. Sodium bicarbonate improves post-exercise recovery and reduces delayed onset muscle soreness. A study from Loughborough University, 10 trained men, randomized crossover design, found that sodium bicarbonate supplementation before exercise significantly reduced markers of muscle damage and perceived soreness in the 24 to 48 hours following intense effort. Biologically, the mechanism involves hydrogen ion buffering again, but in the post-exercise window, it's about reducing the inflammatory cascade triggered by metabolic acidosis in muscle tissue. For men over 60, recovery is the variable that most determines whether exercise produces a net benefit or a net setback. Poor recovery means reduced training frequency, reduced muscle retention, and the gradual physical regression that accelerates every marker of cardiovascular and hormonal decline. Emotionally, this benefit speaks to the men who've backed off physical activity because the recovery cost felt too high. That's not a weakness. That's a rational response to an uncorrected physiological deficit. Practically, for recovery benefits specifically, some research supports a post-exercise dose as well, a small amount dissolved in water within 30 minutes of finishing physical activity. Benefit 10. Sodium bicarbonate supports the gut microbiome environment associated with cardiovascular protection. Emerging research, including a study from the American Heart Association's journal Hypertension, has identified that certain gut bacteria responsible for producing short-chain fatty acids, which directly reduce arterial inflammation, function optimally in a slightly alkaline intestinal environment. Systemic acidosis alters gut pH in ways that suppress these protective bacterial populations. Biologically, the gut cardiovascular axis is one of the most active areas in current cardiovascular research. The same microbial populations that protect arterial walls produce compounds that regulate blood pressure, reduce oxidative stress in endothelial tissue, and support nitric oxide bioavailability. Emotionally, the gut microbiome feels abstract to most men, until it's explained as a direct contributor to blood pressure, arterial health, and vascular performance. Then it becomes immediately relevant. Practically, this is perhaps the most important reason sodium bicarbonate should be taken consistently, not episodically. The microbiome effect is cumulative and environment dependent. Sporadic alkalinization does not produce the same microbiome stabilization as consistent low-dose use. Here is your precise action plan based on what the clinical research supports. Step 1. Start with 1/4 teaspoon of pure sodium bicarbonate, standard baking soda, without aluminum, without added ingredients, dissolved in 8 ounces of water. Take it on an empty stomach or with a very light meal. Do this 3 times per week for the first 2 weeks to assess your tolerance. Step 2. If well tolerated, increase to 4 to 5 times per week at the same dose. For men who are physically active or who have confirmed systemic acidosis through a urine pH test, available at any pharmacy, inexpensive and informative, the dose can be raised to 1/2 teaspoon. Do not exceed 1 teaspoon per day without physician guidance. Step 3. Time your dose strategically. For exercise performance, take it 60 to 90 minutes before activity. For systemic blood flow and overnight vascular recovery, evening timing, 60 minutes before sleep, places the buffering effect during the nocturnal window when vascular repair processes are most active. Step 4. Pair this protocol with adequate hydration. Sodium bicarbonate works within a fluid environment. Men who are chronically underhydrated will see reduced benefit and may experience mild digestive discomfort. 8 to 10 glasses of water per day is the baseline. That is it. 4 steps, inexpensive, measurable, supported by the research. Gentlemen, I want to say something directly. The premise of this channel is not that every health solution is cheap and simple. Sometimes it isn't. But when the clinical evidence points clearly at a low-cost, low-risk intervention that addresses multiple converging mechanisms, endothelial function, nitric oxide production, inflammation, kidney efficiency, hormonal balance, exercise recovery, gut health, and that intervention is being ignored because it doesn't have a marketing budget or a celebrity endorsement, that is exactly the gap I exist to close. You haven't been failing. You've been working with incomplete information. Now you have the full picture. If this video corrected something you believed about baking soda, about blood flow, about what's actually available to you, tell me in the comments. Drop one thing this changed for you. Share this with a man in your life who's been told his circulation decline is simply something to manage, not correct. And subscribe, because next week I'm covering the mineral that most men over 60 are deficient in, that directly impairs blood vessel elasticity. And it's in the same clinical conversation as everything we discussed today. I'm Dr. Emily Carter. The clinical evidence shows that sodium bicarbonate, taken consistently, at the right dose, at the right time, targets the pH-dependent mechanisms of endothelial function, nitric oxide bioavailability, and vascular inflammation that decline with age, and that correcting systemic acid load is one of the most evidence-supported, underutilized strategies available to men over 60 who want to reclaim their circulation, their vigor, and their vitality. Take care of yourself, and I'll see you in the next one.